Thank you. Welcome, ladies and gentlemen. I would like to welcome all the visiting Rotarians, the Rotarians of Rotary Club of Nairobi, the Rotarians of Rotary Club of Milimani, and all visiting Rotarians and guests, as well as our speaker for today, who is also from Rotary Club of Sagam. My name is Ritesh Barot. I'm currently serving as the 90th President of Rotary Club of Nairobi, and I'm honored to have this joint meeting with Rotary Club of Milimani. I'd like, please, President Dr. Philip Simani to also introduce himself and give a welcome to all who have come to the meeting today. Thereafter, Dr. Philip can also say grace.
Thank you very much, Ritesh. My name is Philip Simani, and classification is healthcare. And I'm the outgoing president of the Rotary Club of Milimani, and I'd like to welcome all of you to this meeting. Thank you very much. So why don't we bow our heads with a word of prayer? Oh, Heavenly Father, Lord and Creator, we give you thanks and honor for the gift of this day. Bless our fellowship and thank you for the opportunity to serve our fellow men. Amen. Back to you, Ritesh.
Thank you. Thank you, Dr. Philip Simani. And I will now recite the four-way test. And you may wish to join us, Rotarians and guests who understand the four-way test. Of the things we think, say, or do, is it the truth?
Is it the truth?
Is it fair to all concerned?
To all concerned?
Will it build goodwill and better friendship? And will it be beneficial to
all concerned?
Thank you. And with that, I'd like us all to kindly put our hand to the chest as we give a toast to the President of the Republic of Kenya. To the President.
To the President.
Thank you. And I will now call upon the Vice President, Ambassador Dr. Josephine Ojiambo, to kindly introduce our speaker for today.
Thank you very much, President Ritesh Barot and President Dr. Philip Simani. Fellow Rotarians and guests, it's my absolute pleasure to introduce our speaker this evening at our special session. So our speaker tonight is Khama Rogo, Professor Khama Rogo. Khama Rogo's calling, he is trained as an obstetrician gynecologist. Professor Khama Rogo earned his PhD and fellowship in gynecological oncology from Sweden, qualifying as a second ever gyne oncologist in East Africa. He is a fellow of the European School of Oncology. He's an accomplished academician. After a successful career in academic medicine in 3 continents, Professor Rogo embarked on a career in international health, where he has been an articulate advocate for reproductive health and rights for over 2 decades. He's also strongly committed to community health, quality reproductive health, and has actively participated in all the definitive reproductive health conferences of our times. And these include the Safe Motherhood Conference held in Nairobi in 1987, the ICPD, that's a Conference on Population and Development, held in Cairo in 1994, the Beijing Conference of 1995, and the Safe Motherhood +10 Conference held in Colombo in 1999. Professor Rogo has served as a consultant to all major international development agencies and in all major hospitals in Kenya. He has served on the FIGO, Committee on Women's Sexual and Reproductive Rights, and represented COGS, that's the Kenya Obstetrics and Gynecological Society, in the FIGO Post-Graduate Studies Committee. He was Vice President of IPAS, Vice President for IPAS for Africa, and also Vice President of their Global Affairs function between 1998 and 2000. Professor Rogo has several leadership achievements in the health sector. He served in the health fraternity in several leadership roles, including as president of the Kenya Medical Association, which he held for 4 years, president of the Kenya Cancer Society, which he held for 8 years, and chairman of Kenya's National Council for Population and Development. He's also led the Kenya Obstetrical and Gynecological Society for many years. During his tenure as president of the Kenya Medical Association, the organization introduced a local medical indemnity scheme for doctors, amongst other welfare objectives. In Kenya, Dr. Rogo has been a strong and forthright voice in all matters of quality healthcare and human reproductive health over the last 3 decades. He recently catalyzed the formation of the East Central and Southern Africa College of Obstetricians and Gynecologists. Professor Rogo is a guru at building multidisciplinary and multi-sector projects. He's the founder of the Center for the Study of Adolescents in Nairobi. This is a leading research entity on youth and adolescent health, as well as a founder of the Nairobi Oncology Center, the first specialist cancer care and advisory clinic in East Africa. He's the founder of the Kisumu Health and Education Trust, which focuses on adolescent reproductive health. This particular education trust is interesting because it also provides loans to small and micro enterprise agencies in health. And it's called, in short, KEMET. KEMET was a winner of the Margaret Sanger Award in 2004. Professor Rogo is a co-founder of 2 innovative hospital programs in Kenya, one being the Sagam Community Hospital in rural Siaya, and another being the Nairobi Women's Hospital. I want to be associated with Nairobi Women's Hospital. This is a model of excellence, and I launched this hospital together with others while serving as president of the Kenya Medical Women's Association. I'll go fast forward. Professor Rogo's CV is really sterling, but I want you to know his advice and opinions are widely sought. Professor Rogo has previously served on several advisory boards, including the board of the David and Foundation and the board of the Intra Health and the board of the Center for African Family Studies. He has served successful terms on the board of the Regional Prevention of Mortality Network, WHO's Gender. He was also a member of the joint WHO, UNFPA, UNICEF, and World Bank Regional Task Force for Reproductive Health and the NEPAD Health Committee. Professor Rogo was recently selected as the first ambassador and chief advisor to the Federation of American Health Businesses in Africa. He serves on the boards of both IntraHealth and Farm Access Foundation. Professor Rogo has worked at the World Bank in several stellar portfolios, initially as a senior global advisor for population and reproductive health. And later, his work at the bank would lead him to the role of lead health sector specialist and head of health in Africa initiative. This is a private sector health-focused program of the World Bank. He's a well-acknowledged resource. He's well published with over 150 peer-reviewed papers, chapters, and books. Professor Rogo is a recipient of multiple awards and honors in the region and abroad, and continues to pursue academia through numerous adjunct professional appointments, lectures, supervision of postgraduate students, and external examination in universities in Africa, Europe, and North America. Recently, that's in 2019, Professor Rogo was awarded Kenya's first Lifetime Achievement Award in Healthcare. From his rural home, and more recently, he was appointed to chair the Lake Basin Economic Bloc's Eminent Persons Advisory Committee on COVID-19. This appointment is one that we at Rotary derive great benefit from. Professor Rogo is a proud Rotarian and has inaugurated Africa's most rural Rotary Club in Africa in his ancestral home, the Rotary Club of Sagam. Despite his accomplishments, Professor Rogo is most proud of his longevity in the pursuit of quality and excellence in the health profession, and of being a simple villager, a husband and father to a humble and caring Kenyan family. Fellow Rotarians and guests, it's my pleasure to introduce and give you this evening's keynote speaker, Professor Khama Rogo. May I introduce Dr. Rogo and ask Dr. Rogo to speak? Dr. Rogo, you have the floor.
Thank you very much, Josephine. I am in the village where I proudly come from, so my connectivity may fail me. I'll therefore not try to make you see me, and it will help me because I'm not very handsome, not worth looking at. In doing so, however, I hope, Josephine, that you will have my slides. There are 10 of them. They'll be very, very short, and I hope to drive the point home as soon as possible. I speak to you as a Rotarian, but most important, as the chairman of the Committee of Eminent Persons that was inaugurated by the 14 governors in the Lake Region Basin to help advise on the fight against COVID. It is in that context that I would like to join forces with fellow Rotarians and share with them what we are doing and why we are doing. I do not know if the slides are on, Josephine, just confirm so, because I can do without them too, and you can give them the slides later if it is a problem. Are we still together?
Yes, we are.
Yes. So my conversation with you this evening, fellow Rotarians, is about Adopt a School initiative. Adopt a School initiative is an initiative of the LREB committee that I chair. This committee has 21 individuals representing the 14 counties of Western Kenya. They were each selected independently by each governor for their county, and I was asked to chair it. It is really a group of eminent persons. We have age and experience in the form of former Vice President Awori, representing Busia. We have stamina and durability in the form of Eliud Kipchoge, representing Nandi County. We have diligence and experience in monetary matters represented by Edward Ouko, the immediate former Auditor General. We have a combination of corporate skills represented by my friend Bath Ragalo, who has led Tyson's, for you people who are in Nairobi. We have the legal experience of my sister, Catherine Muma, whom you all know for all the legal work and constitution and so on that he does. And I could go on and on and on. We have business people, we have everybody. And ours was very, very simple since we were launched last year by His Excellency C.S. Wamalwa at the grounds, Kenyatta Sports Grounds in Kisumu. Mission: defeat COVID. Absolutely, defeat COVID. Next slide. Next slide, please. This slide shows you the 14 counties and is also a heat map for COVID in this particular region. As you know, we have nearly 15 million Kenyans in this region. That heat map represents a few things that I'd like to explain to you. That in the 14 counties, we have seen 3 different modes and speed of spread of COVID. First group, where COVID has been most heated, has been initially the border counties of Busia and Migori. They have what we call trans-border transmission. It is driven by the economy of the border, the cross-border activities, and most sadly, by our inability to manage border crossing for long-distance driver. So that as we speak, from Malaba border into Kenya, we have 20 kilometers of lorries sitting there waiting to cross the border, either because there is no test being waited for or other reasons. Another 10 kilometers on the Busia tide. Those are people who create a hotspot in those counties. And from what we have seen, their incidence and prevalence of COVID is related to that failure to control border crossing. The second group is the groups that have big urban populations led by Kisumu, Kericho, Kakamega, and Bungoma. We have seen much more rapid spread in these urban populations for reasons that you people in Nairobi don't need to be explained to. They are also the fastest in terms of being in touch with Nairobi and Mombasa. The third group have been what I, for want of a better word, call rural counties. And there's 5 or so of them that include Siaya, they include Homa Bay, Nandi, Bomet, Vihiga, and Trans Nzoia. These are counties that are slowly absorbing COVID because they are not in touch with you people in Nairobi as much. And when they come in and when it started, it was Nairobi people bringing in a body or coming in for some ceremony. And we have seen that pattern kept. It is our fear that the community spread in this area is going to be catastrophic when the third group of counties start seeing the heat map start hitting. And it is going to happen because every time you close Nairobi, as you recently did, and you open, when you open, there is a rush to the counties. And when you open the schools too, that rush is even more. So beware that you are going to be and continue to be the source of our COVID. I'd like to go to the next slide, if you please, Josephine, which is a result of some of the work that we are doing in the region. My committee and my team have a statistical team that has been projecting COVID spread both for the country and for the region. And we often love comparing what our findings are with that of the country. What it shows you, I don't think that you're seeing everything on that slide, but you can see there the 3 waves that started last year, and we are in the 3rd wave right now. What we have learned from our work here in rural Western Kenya is that these 3 waves tell a very interesting story. Number 1, the interval between them is exactly the same. It's actually about 55 days. So every 55 days, we get a new wave. Secondly, each subsequent wave lasts longer and is more intense than the previous one. And that is why you see the lower hill in the first one, the higher one, and a peaking one more recently. Beware, though, that the drivers of these waves is our behavior or our lack of doing something significant continuously to mitigate against this pandemic. And we close for a while. The virus, which is a clever one, hides for a while. You come back with your old bad habits, and it comes back and enjoys the ruling. What we have projecting is that the third wave which we are on is not over yet. And we are sad that Nairobi has opened up because we had predicted that it will go down a little bit to give us a mellowing effect and come up again until June. And after June, going into July, you can count 55 days later and you're predicting a fourth wave sometime in October. That is going to be worse than this third wave. That's going to last longer than the third wave. And that will force us again to close the economy. If our prediction is right, and with the current closure and a subsequent one, then it will mean that we have lost this year, just like we lost last year. And the reason is very, very simple. We keep misbehaving. And this virus runs on the fuel of two things. One is people who crowd. Two is people who change their positions or places by speed. So you travel often, travel much quickly, you crowd often, crowd much, and that is it. And in our countries, we do know that the crowding is not the type that you get in Europe and America in stadia and music concerts. No, it is in the marketplaces. For you people in Nairobi, it is the mega malls and so on. And then it is in the matatus and the transport system. And of course, when schools open, Nairobi people, you know, that everybody starts moving. All of a sudden, the roads are full with traffic and all. So we are the beneficiaries of your bad behavior, and we copy you without doubt. Now, seeing that from our side, we thought that we could do something more than everybody else is doing. And given that schools are an open door to both movement and crowding, we wanted to do something about schools. And we wanted to do it in schools for several reasons. One, we believe that it is only through schools that you can actually reach parents and communities. And it is through those kids that you can make things happen. So we came up with the Adopt a School initiative, which is innovative, homegrown, and I emphasize that, voluntary actions to keep COVID out of schools and keep schools open. We believe that is not just a question of opening schools, but is keeping them open and removing anxiety from parents who keep waiting for the phone to ring, that the headmaster of that school has called them, that a kid or a teacher was found there. But more than that, we felt that going to school is a big equalizer. Many of you sitting in this conversation today know that without going to school, you won't be there. I definitely won't be there. So anything that stops a kid from going to school stops growth and realization of those dreams and the potentials that we all have. It doesn't matter what your status in life is. You saw yesterday, I saw on television when the two top KCE boys were being interviewed. One of them had spent the last COVID closure in his parents' home in Kibera, and the only room that was available for him was the toilet where he would be studying at night. And he came out to be the top student. COVID spared him. But that will not be the same for many of our kids who could be that kid who I heard yesterday wants to be a doctor like me, and I pray for him to get there. So schools are an important. And for our region, we are talking about 15,000 plus schools with a capacity of more than 5 million pupils. And we believe that these are linked to households and families. And if we can get the message through that the only way of keeping your kid to school is by parents behaving, we are going to open a new chapter in the conversation. In doing so, we have several key foci. One is developing a new, next slide, community school professionals partnership that brings skills and resources to enhance promotion of health in school. This partnership has never been seen as important in our education and health system, but I believe it is a fundamental thing that can change the health trajectory, not only of COVID, but all the other diseases in this country. Second is realigning the roles of school alumni in adopting a school movement. The alumni movement is not very strong in this country and is often left to some old traditional schools like Alliance and so on. Even the alumni of my alma mater, University of Nairobi, is not as strong as it can be. But if you live or stay in the US for a while, you will find that the biggest difference in development institutions between it and Europe has been the strength of the alumni. So that school where you went that produced you can produce many like you if you enable it for that to happen. Three is a structured monitoring and accountability. It's not a question of donating and going away. It's a question of growing with the kids and accounting for everything that is in. We did find that our schools receive many donations. A bus here, wheelchair there, water tank there, and so on. But that doesn't change behavior. We have to be there for the next generation for us to be there. And then, of course, fourth is sharing best practices from county to county, from school to school, from social group to social group, from individual households to individual households. There's a reason why certain things happen in some places, and there's reasons why some places are spared. Those things must be focused on. Continue, Rosalind. Josephine, the next slide. The milestones that we have seen since we started this late last year include the following. We have mapped and are coordinating Ministry of Education, Ministries of Health, and adopters in all our counties. You'll be surprised at how rarely these two ministries speak to each other. You'll be surprised how little they think that they share outside of the cabinet meetings. But now we are forcing it to happen because none of them can do it alone. We all got to be there, and they've got to know that they can't do it alone. They must do it with the communities and these adopters. Two, online adoption registration tools. We have developed it. You can go to our website and see. It is simple. It doesn't matter whether you're in Greenland or in Kericho. You can go there, pick the school that you want, start communicating with the leadership of that school, and be part of that. Three, the official launch of this initiative by all our governors and by each governor in their county, so that people know that it has the highest level of political support. Let's not take that thing for granted. Our leaders, the MCAs, the members of parliament must be in this. And we are insisting that each MCA launches this in their ward, because it is at that level that people really feel the negative effects of the pandemic. Then the monitoring and coordinated data management system across all LREB counties. So we can tell you on a daily basis how many schools have gotten an adopter, what the adopters are working with them on. But we've also seen the returns in the form of material and public health intellectual returns on masking, hand washing, spacing, which means that the kids are not in a classroom. That the kids are spaced appropriately, both in classroom and outside, psychological support to the teachers and the pupils, and hygiene, the wash phenomenon being there. And we have data to show us that. Next slide is giving you an example of how my own governor, Rasanga, has taken this to heart. And when we went to him, he was the first one to individually adopt 10 schools and mandated each of his cabinet ministers to adopt the schools in their areas and work with them, and we give the reports of that. Yes, it can be done by anybody, it doesn't have to be the governor. And we can see that when these things happen, suddenly in the schools, water tanks arrive. Suddenly in the schools, people know about the produce, the products, brilliant people who have passed through those mud flawed classrooms. Masks appear, water is flowing, sanitizers are there, not because some rich person has come, but because the people who care are there. And in doing so, so far, we have over 1,002 schools as distributed the way you are seeing it. Some counties doing better than the others, but we are in the early stages and moving forward with it. Now, we have seen, for example, SIAYA playing a mentoring role recently in communicating with another county to advise them on what to do. And Nyamira County, after discussion directly with SIAYA, just this week alone, has more than 20 new schools that they have created adoption for. So it is possible that we do it. Now, the reason why we are saying that it is possible is because we have partnerships galore in this country that we are not using enough. Unfortunately, the Harambee spirit has been infected to make people feel that there has to be a rich person with a tummy that is smaller, bigger than mine, whom you wait for as a chief guest to come and donate some big money, and you people just clap there and sing his praises. Note that this is about people who can do something. That person in the village there who's just a carpenter, but will come to help the school fix the door or the window and so on. It is not about donors coming from outside. Unfortunately, or fortunately, COVID affects every country. So for us to sit here in LREB or in Africa or in Kenya, thinking that it is a responsibility of some white young lady in Finland to come and do something about the school in my village, in my locality, I think is immoral. And we have to move out of this. If Josephine, you can move to the next slide. And the next slide on inclusivity, and get all these people in. That there is room for everybody, communities as individuals, for social groups like us in Rotary, for professional societies. And when I started this, the first group that I got in touch with was my own. I got the president of KMA, president of the Nursing Association, president of Clinical Officer Association, and I said that your members come from every nook and corner in this country. We want them to be part of the adoption of schools in their areas. We want to be the advisors to the schools where we come from, rather than relying on somebody to arrive from India. And we can do it. We've gotten the philanthropies in. Aga Khan Group has approached us to see what we can do together, building on what they're doing together before. World Vision are very connected to us right now because we are doing it genuinely and from the ground. The alumni associations that we want to reform, that they must not only meet when one of them is dead, they must meet to celebrate the schools that produce them. And this change is needed now, and we can do it. And of course, private business and enterprises. Inclusivity is a key thing to adoption of the school. It is not the rich person, it's the person with a heart to open to the next generation. And my final slide. As an African, I believe in Ubuntu, which is summarized as I am because they are. I really believe that I am because of the schools that I went to. It must be that for everyone. And I believe too that there is an ethical confluence between Ubuntu and the four-way test that we all verbalized at the beginning of this meeting. Because it is when I am because they are and I believe it, that the four-way test becomes a reality. Ladies and gentlemen, welcome to our program of a doctor school. If Rotary is, and we are Rotarians, is really serious, then this is one time when you have an opportunity to change the world, not only for ourselves, but for that next generation. Thank you for the honor of addressing 2 Rotary clubs this evening.
Thank you very much indeed, Professor Dr. Rogo, for that wonderful and insightful presentation. And I'd like to please call upon President Dr. Philip Simani to kindly raise a question to you, followed by Ambassador Dr. Josephine.
Thank you very much, President Ritesh Barot. And it's really a great privilege to have Professor Khama Rogo with us today. I remember the first time I met Professor Khama Rogo was 40 years ago in 1980 when I witnessed my first cesarean section, and there he was operating with Professor Ojwang. And ever since, we've always maintained a cordial relationship. Thank you very much. It's really nice to have you here, Professor. I'd like to change gears a little because you wear many hats, Professor. You wear many hats. And I'd like to address your role with the World Bank. You are a lead health advisor to the World Bank. And my question is, what are some of the challenges that prevent the bank from sponsoring developing countries to develop their own vaccine to tackle the COVID crisis? What is it that prevents the World Bank from partnering with developing countries in development of a vaccine? Thank you.
Shall I answer or we take more questions?
I guess Josephine can go ahead with hers as well, and then we can invite everyone to write your questions on chat, and we can then go down the list.
Yeah. First of all, I want to thank Professor Rogo for an amazing presentation. Thank you very much. And also for the honor that we have in sharing with you this particular initiative on a doctor school. I am particularly pleased because I've known Professor Rogo over the years, and I continue to honor not only his presence as a health professional here and globally, but I am honored by the fact that we can continue to engage. I'd like to ask a question very specifically about private business. And I want to ask, because you have in your CV made reference to the initiative that you took for the World Bank in private business. How can we more effectively rope in private business at national level so that we can have a doctor's school become a movement? What can we do and what should we do, especially as Rotarians, to draw on private business? Thank you.
I'll answer very quickly to Philip Simani, my colleague. Nice to see you after so many years. Just to go on the record that I retired from the World Bank at the end of last year. So I'm comfortably and happily in my village in Siaya where I'm speaking. But I'll answer that question as somebody who knows how the World Bank works. The World Bank belongs to all the countries who are members. It is run by executive directors that represent either individual countries, for countries that have more say and money in there, or groups of countries. Africa has two representatives, one for West and Francophone side of Africa, and one from this side. The decision that is made there is made by those representations. The money that is there, therefore, goes into the thing that the countries want to be funded. The World Bank has two sides. One is that it gives loans, and those loans are higher interest rates for middle income countries and none or full interest rates, rather for countries that are rich, they don't even borrow there. And if they did, they would be charged the commercial rates. For countries like ours, we've gone into middle income, so our situation is changing. Most of the money that comes to us is grants or virtually zero interest rates. 0.5% interest is just the paperwork. The choice of what money we go to do what with is left to the individual countries. So nobody's going to come and tell you, let me give you money so that you do research on vaccines. It is that country or group of countries that go for it. In the 20-something years that I've been with the bank, I have related with many delegations from Africa and other developing countries, and never once have I had from either the education ministers, president, or health ministers, anybody wanting to borrow money for research. When you borrow money from the bank, they insist that that money is used for the intended purpose. And from the data that I have, our countries, when they start research institutions, they do not start with the intention of funding them. They start with the intention of getting funds from elsewhere. Take our own KEMRI. We can hardly pay the salaries of KEMRI workers, leave alone do the research. Now, research for vaccines is a long journey. It's not a 2-year journey. It's a long journey, and it requires diligence and people who are there. So you need to have serious scientists who are working in an institution comfortably for probably their lifetime, for them to be able to come with the transformative things like vaccines. If we went to KEMRI or any other African institution and found the researchers there, you'd find that their longevity in the institution is not only short, but their allegiance is to the person who pays the piper. So to say that they will be sitting there doing this serious long-term research is a pipeline dream that for us to realize, it will require more structural changes. So President Philip Simani, the money could be availed, but we have to ask for it. But we need severe structural reforms in our countries to put research and science where it belongs, not just politics, for us to be able to do that. To my sister Josephine, to whom I must confess that her father, Professor Hilary Ojambo, was my mentor, and I forever grateful for that. The non-state actors in this country run what you call philanthropy. The first group of that usually are the one who call it corporate social responsibility. It is interesting that we've never done enough research in this country to see the extent of corporate social responsibility, which all the big companies actually put money into, whether it's ABSA, Standard Bank, and so on. And this could be restructured to focus and transform, rather than just giving small monies here and there and so on. Secondly, there are companies that are not doing that, but do give. Unfortunately, the giving in Africa has been tied to visibility in politics. People don't give quietly. They give because so-and-so is coming there on that day. We've seen some of that, for example, in the availability of oxygen now that we are in a problem. That thing needs to be sorted out, and working with KEFSA and so with the private sector group, we can reform that particular area and move forward. And finally, our tax system must be transformed and reformed to start appreciating philanthropy. For most of our countries, the part of escaping taxation is so easy that you don't need to give any money away rather than it getting taxed. The Gates and all these people, the money that they pack in their foundations is to reduce the taxation that they would otherwise get. Europe had never gone that way. Africa needs to go that way, so that if Dangote or me put some money into serious foundation and philanthropy, it is off tax, and it should be made easier and be able to move forward. And finally, it is advocacy. And I believe Rotary Club, given the plethora of businessmen who are in Rotary, we could get something done differently. And COVID probably is a challenge that would require the kind of approach, Josephine, that you'd like to see from the private sector. I stop there.
Thank you. There are lots of questions in the chat box. And between Dr. Philip Simani, President of the Rotary Club of Milimani, and myself, we will give voice to those questions. Dr. Simani, would you like to have a go?
Oh, thank you very much, Josephine. This is a question from Gilda Odera. What can be done to have more authentic information available to those who have suffered from COVID-19 to help in restoration? There is inconsistency in information on post-COVID management, making some go through long COVID when it could be better managed.
That's a good question, Hilda, and I think that it points to the failure of our health system. And it is something that I would like as to address to the professional associations in this country. I believe that professionalism has been one of our weakest areas. And we often blame institutions and not ask who are the people in those institutions. I believe that by now, the professional association should be addressing that thing by creating centers or places where people can go for psychological support and other forms of support. I believe professional association should be more vocal in the use of mass media to educate the people. Where do I find a column of KMA every Friday that handles something on COVID? Where do I find a podcast that is run by professionals in the area? These are the things that appear small, but they are the things that make a difference to the kind of question that you are asking. So rather than sitting there and hoping that a beleaguered Ministry of Health in Bungoma is going to do this, what we should be asking is, do we have enough caring professionals in this country? It is my position that Kenya is luckier than any African country that I've worked in, and I've worked in each one of them. We have some of the highest seedings of health professionals that you can get anywhere. Just nursing alone, we have more than 100,000 nurses, the highest in East Southern Africa after South Africa, which has 200,000. And then we have doctors, we have the other clinicians and so on. We all come from wards. It's difficult to get a ward in Kenya that doesn't have a nurse or a doctor or a teacher or so on. So it's a question of trying to reorganize society in a manner that society starts benefiting from the few skills that we have around us. Unfortunately, too many of our professionals only give this when they're paid by the employer or paid by the individual patient. And I think that we need to turn this around. And I would urge the two presidents who are here that why don't we take this up with Rotarian health professionals and start creating a movement that gives back without forgetting the four-way test. I believe that we could maximize on what we do and tremendously reduce the hunger and the suffering that our people go through on a daily basis. I believe that there is something that Rotary can do, and it is you and me to do it. Thank you.
I'll continue with the discussion, and I'll broach two issues. One is raised by none other than Lady Justice Joyce Alwach, who is on the call, Prof. Rogo, and we are very blessed at the Rotary Club of Nairobi to have her as one of our members. So Lady Justice Joyce Alwach asks, tongue-in-cheek, are you blaming people from Nairobi for the incidence of COVID in the rural areas? Tongue-in-cheek. And then another question is asked by young Kevin Odworo Tieno, one of my students in the School of Public Health at Kenyatta University. He asks about the role of young people and the vulnerable in terms of inclusivity around COVID-19. Over to you, Professor Rogo.
Thank you very much to Lady Justice. I think that it is more than a tongue in the cheek, because there's something about COVID that we have to understand. That COVID started in China, but it never came directly to Africa. It went, first of all, to Europe and America. Why? Because the frequency of movement between China and those other continents is way, way lower. So frequency of contact and movement, the speed and the quantity of it has carried COVID to the next location. So how did COVID arrive here? COVID arrived here by air. And you will recall that one of the first casualties of COVID in Kenya was a venerated high-class pilot from the 787 from New York. So the only place where people land directly when you come from outside is Nairobi. No wonder, if you look at the first wave, it was virtually confined to Nairobi and Mombasa. So the next movement that brought in the wave was when movement started taking place between Nairobi and Mombasa and the rest of the country. And that is the movement of that. I don't want to call it blaming. I call it being aware, positional spatial awareness of movement of people and disease. COVID is carried by people, and it's carried by people who have been in touch with somebody who had it. And when we look at some of the cases that we've had in our region here in LREB, we can see it, that it is this group that came from this funeral on this day and the contacts and so on. I don't want to call it blaming Nairobi, but I want us to be clear that it is there. Now for Western Kenya, we are particularly unfortunate because we are essentially an exporter of labor. Our daughters and brothers and sisters are in Nairobi and Mombasa earning living for ourselves. And we rely on them to advise us. We expect them to come to our aid when we are in problems. And that movement up and down is part of it. And that is why for LREB and our advisory, we have always told the governors that one of the most important interventions is that we reach out to those social and community associations in Nairobi and Mombasa, so that they know that much as we love them, when they're coming this way, let them come with a lot of caution, and if possible, let them be sure that they do not have symptoms like COVID. That is just plain public health reasoning, my sister, Lady Justice Joyce. And by the way, you don't have to come. You can always send the money to help us through M-Pesa. And if I were to choose between COVID and M-Pesa send, I'd go on M-Pesa. The next question is from the young friend of mine, Kevin Oduor. Yes, the role of young people in this inclusivity is one that we need to reiterate. Because when this COVID started, because young people were safe from it, the messages that went out is that, don't worry, this is not your disease. Over time, we've realized that young people can be carriers. They don't have to suffer. But even worse, we have realized that they are now suffering because the new variants are not sparing young people. I see them playing a big role in knowledge dissemination, in advocacy. I see them bringing in the energy that is needed, even in the adopt school, because your numbers are bigger as alumni of schools that you recently left. If you look at people like me or older, our numbers as alumni has been denuded by the forces of nature. We die off, but your numbers keep increasing. I believe you can drive a very, very successful and innovative adopt a school initiative in that age group. And I look forward to communicating with you on this matter. Thank you.
Thank you very much. The next question is from Rose Baraza. Rose Baraza is an entrepreneur in the Rotary Club of Milimani, and she is a rising star in the ICT space at the national level. And what Rose Baraza says is that you have mentioned country-level factors that appear to hinder the reopening of school adoption tools. However, we are bridging the digital divide. Do you feel the adoption of remote learning continues to be an important element for public education, especially for needy communities? How can schools, government, and districts ensure remote learning to ensure success for the anticipated fourth wave? This is to prevent the steps that led to other schools being closed in those areas away from the cities, i.e. Busia.
I love that question. Very, very true. And one that I would probe for this reason, that unfortunately there is a inverse relationship between IT connectivity and poverty and rurality. Direct correlation and inverse correlation. The poorer you are, the less access you have. Even when there is a place where you can go and access internet, the cost of internet, you probably saw recently that Kenya is one of the most expensive costs of internet. Part of it is tied to taxation, and we are going to make it even more expensive. I believe that COVID has sent us a message that the days when face-to-face was the only way of passing information, doing business and learning are gone. We must now not wait to get back to business as usual, but work forward and see how we can improve that connectivity and the messaging that passes through them. At the university level, we know that some of the biggest universities in the world apply distant learning. We have to get that down to the lowest level possible and see where it is, and then work out for very young kids the advantages, psychological ones, of growing and working and playing in a group. That is why you will see that the countries that have more resources than us are moving rapidly to make sure that they immunize the kids so that you get them out into play groups. But when necessary, they will be able to access a lot of information without crowding in one place. Just today, the US has approved the Pfizer vaccine for 12 years and above. And that's a big step that is being taken. For us here, we can't even start talking about it because we have vaccinated 1 million people and all of them have only gotten the first dose and nothing more. So I do believe that when the other countries are opening up, we shall not open up if it is based on scientific reasons for doing so. And for us to keep up with them, we'll have to find alternative modes of communication. And ICT must be at the center of it. So I would like to see a robust debate and action in this area, knowing that ICT connectivity should be seen as not a privilege, but an essential commodity for learning and livelihood to move forward. You are in the right place, just do it. And now that you mentioned Busia, I'm sure that Josephine wants to do something about it, and that even Philip Simani wants to do something about it. I've never seen a more endowed county in health and professionalism than Busia. And I was in Busia for the launch of our initiative, and I made that story very, very clear that there was a time in this country when out of 10 top specialists, 8 would be from Busia. And at that time I was alive and I was a student. But we have to get back now and make that connectivity possible. Thank you.
Thank you for stirring us all up. I have another question, and I'm sure that very soon the presidents will call us to order in terms of the content we've covered. But mine is about going beyond WASH to the area of behavior change, and specifically ending violence against children. Prof, you know that during the time children have been away, many of them have suffered violations in their own home and family settings, as well as in the communities. And also that lockdown for all of us has a bearing on our emotional health. Amongst us tonight, we have David Mutai from the United Kingdom, Morel Foreman from both the United Kingdom and Kenya, and Edna Chelule from Sotik. Apart from the Rotaractors and Rotarians, with interactors who are delving into the area of behavior change to support WASH, but also to address ending violence against children. And the team from the UK is specifically working on positive behavior change so that we don't wait for violence, but we stem it by putting in place positive behavior change for the children in classes, between children and authority figures, but also for the children to take home to their families and communities. I just want to ask you if you have any comments on behavior change modification and how a doctor school can play a role in this particular area. And with that, a question on whether we should focus on primary or secondary schools for a doctor school. Thank you.
Thank you. Let me answer the last one, that adopt a school should be done at all levels because learning is relevant at all levels. So I would not want to prioritize one over the other. I see that learning is a continuous thing. 2, when it comes to the issue of behavior change, unfortunately, there's a lot of communication in our part of the world, but not very much that is focused on changing behavior. And a good one is what Waziri Kagwe and Minister of Health do every afternoon on COVID. I wish they could change the format, because the way they present, it's now like a happy hour. It's not giving people a message of what do these data mean for which people where. And yet that is an opportunity that we are losing now for one whole year. It's not enough to come and tell us, today we tested 13 and 2 are positive. Absolutely not. So we have communication specialists. And in our region, one of the things that our committee has done is to bring together all people who are specialists in communication. And they now have a web connectivity. And when we asked for that, Josephine, I was amazed at the number of communication specialists who are serving in the UN, serving here in Kenya, serving everywhere, who know exactly what behavior communication is. And they're all crying out, why don't we do it? The problem is that we are waiting for somebody else to come and do it. Even worse, we are waiting to DFID to come and fund us to do it. This is an existential war. It must be in you and in me to use my skills if I don't do it for the rest of the county or the ward, at least let me do it for my community and my village. If I don't do that, let me do it for my household. It's not happening there. And when it's not happening there, you don't expect it to all of a sudden bludgeon into a movement. I believe, and I'm old enough to know, that in traditional Africa, whenever a strange disease hit the community, the elders would meet and decide for the people on what can be done, what cannot be done. Don't eat chicken that has just died or fresh. Make sure that you put it over fire, or the meat stays for 2 weeks before you eat it. And they went further and started creating mythology that if you do this, you'll never have a child. Some of it was deliberate to get people to change their behavior, and it worked. But what has happened right now is that we are in that trajectory where traditional advice is not there. Government, nobody trusts government in Africa. That's a tragedy. So who is it that is going to take this? It has to be professionals like yourselves and mine. It has to be parents. It has to be individual. Behavior change we have seen from COVID has already reduced drastically the incidence of diarrheal diseases in Africa. You don't even hear about cholera anymore because people are washing hands. So this is something that we can do and we must do. And I plead with everybody in Rotary to take this seriously and make it happen. Thank you.
Thank you very much, Professor Rogo. And now back to President Ritesh Barrow.
Thank you very much indeed, President Dr. Philip Simani. And Professor Rogo, thank you for this very enlightening talk today. And I'd like to share with all who are present today that this talk is going to be uploaded. There's a recording onto YouTube, and with your permission, we will be in a position to share this with club members who have not been able to participate in the meeting today, because the meeting, you have shared some interesting slides, but also through the actual presentation and the Q&A, the information you have shared with us is very thought-provoking. And at the same time, you have challenged us to take on this task as both President Philip and myself. So thank you for this time you have allocated to us. And I'd like us all to kindly raise a toast to the Rotary Club of Nairobi, Rotary Club of Milimani, Rotary Club of Sagam, and to Rotary the world over.
Rotary the world over.
Thank you.
Thank you so much.